THA Talks, for free thought and open minds.
And for freedom of speech.
Hello, I'm Paul Obitelli and welcome to another edition of THA Talks, the alternative podcast show from the UK. Our talks include news, conspiracy, spirituality, the occult, science, history, art, philosophy, religion, and much more. If you'd like to check out our full archive, just go to www.thatalks.com to listen to or to download all our free content. And if there's anyone who'd like to contact us and give us some feedback, maybe you'd like to recommend a guest for the show, you can email us info@thatalks.com. And don't forget, you can subscribe to the show via our RSS feed, and you can also find us on iTunes, Stitcher, Spotify, YouTube, and many other podcast directories out there. Hello, welcome back. Thanks for tuning in again. It's been a while. I have actually been working on a new website for the show, and that's been taking up a bit of my time. I've started that off, and I'm going to be transferring all the content onto that new website. When it's done, it's a bit slow and dragging the old one, and it's costing me more money. So I'm going to be cracking on with that new website. I've also been slowed down a little bit with gout, believe it or not, which is like arthritis, mainly in the foot. And that's been slowing me down somewhat as well. So, but I'm on the up, hopefully. And, anyway, so, we're going to be talking today about that big one that's in the news all over the world, not just in this country, but everywhere. People are talking about this virus, coronavirus. And we're going to be speaking with our friend John White about it. Is there something to be worried about? Is there not something to be worried about it? Or is there something else that we should be worried about? We're going to be speaking about that this evening with John White. How are you doing, John?
Good evening, Paul. Good evening, THA. Well, I'm here with a somber mood today because this is one of the most serious topics that we could possibly be covering. And, this is a little bit more than a curiosity. This is very vital information, because we're going to see a lot of stuff come down the pipe now, which is going to really change our expectations of this year, big style, because there's big changes coming to adapt to what's now happening worldwide with this COVID-19 outbreak.
Okay, so I mean, in the past we've seen like swine flu, all these different types of viruses that the media go on about, and it kind of just ends up coming to nothing. It's like nothing worse than another flu. Where do you sit with this one? Obviously the media has really gone to town with this. Everywhere every station you switch on, every TV, it's got it there. There's no way we're getting away from it. Is it hype, or is it,
since the start of this century, we've had SARS, we've had MERS, we've had swine flu, we've had Ebola, and you're absolutely right. Every time one of these things happens, the media goes full tits up, making so much of a fuss about it. But the problem has always been that the time might come when that boy who cried wolf approach could leave us looking suddenly very vulnerable.
Yeah.
And I want to start off by sort of saying where I'm coming from on this one, because I haven't tended to make this public knowledge, because I tend to try and keep my online life and my private life separate, as I think many sensible people do.
Yeah.
But I have a long background working in health and social care, and I'm educated to a university degree level in a very important topic for this called infection control.
Right.
Now, because of that, I've for many years, I've had to take quite serious note of how to protect oneself from infections, because when you're dealing with very sick people, and you're dealing with, their care needs, and you do certain things for people, you have to be careful that you don't make yourself ill in the process of doing so. So there are certain things which are sort of ground into me by my training.
Yeah.
Things like, being careful not to touch your face with a contaminated glove, for example, because not to be indelicate about it, if you're dealing with a problem from someone's bottom end, and a lot of stuff comes out of someone's bottom end, but you don't want it going in the top end.
Yeah.
So as a health and social care worker during my professional career, I've been very aware of the need to protect oneself from infections, bacteria, and here we are talking about a very nasty virus.
Right.
Now, where should we start from with this? I mean, look, there's one thing we can say straight away that makes this totally different to all the other things we just mentioned. Everything about those and how the media presented them was in the realms of might, maybe, could, possibly, and it was all about words like that. But the actual events themselves were relatively contained. MERS didn't spread outside of the Middle East. SARS didn't spread outside of Asia. Ebola didn't spread outside of Africa. So these threats were contained. And yes, there was a lot of hyperbole about them. But when we look at what is happening now around the world right now, when we look at the fact that we have coronavirus, we could call it coronavirus, but really it's COVID-19, which is a strand of coronavirus, because coronavirus is a whole category of viruses. And when we look at what's happening, it's now already in the majority of the countries of the world. So this is not a drill, people.
Yeah.
We suddenly have a major public health hazard, not just across the West, but across the East. And looking at monitoring reports today, it is now in South America and it is now in Africa. It's mostly in Asia, but it's getting pretty strong in the Middle East. Iran is in big trouble. Italy is in big trouble. Germany and France are not far behind. Spain as well. We could say that Europe has already kind of on the process of falling to this. And that, there's governments across the West, including also reported today in America, are now kind of reluctantly being dragged to admitting that we're already past the point where we could look at containment of this. And instead we're looking at a different strategy, which is called mitigation. Which means that you try to put as many road bumps in the thing's way as possible, so that you try to limit the amount of people who get sick in terms of the time at which they get sick, so that systems don't get overloaded. We are in a national crisis. There is no doubt about that. I mean, that was clear last week from a COBA meeting. But I think that partly because of this effect that you've talked about, partly because people have heard it all before, or at least think they have, the reality is sinking in with a kind of dread in the back of the mind. So what I put together today, I've got I can give a sort of background of a history of where this has come from, and the things which have happened so far. But what I most want to get across is advice based in good infection control practice, including drawing on the testimony of experts who were involved in fighting SARS, which is similar but not the same as COVID-19.
Right. Okay.
So where should we start our picture? Let's see. I mean, we could start with the beginning. This thing didn't exist anywhere until the 1st of December, 2019. And that is the origin of patient zero, which of course is in the city of Wuhan in China. Now, the world itself didn't know about patient zero for the whole of December. Because China sat on what was going on until the 31st of December, where it told the World Health Organization. The World Health Organization then sent an international task force to Wuhan to evaluate and assist, etc., with what was going on there. And then the WHO then declared an international emergency on the 30th of January. And we are now on the 9th of March. So straight away, doesn't that give us a picture of something which is advancing incredibly quickly through human civilization across the planet now.
Yeah, I mean, the thing is, it's certainly worrying because you're basically just seeing these numbers go up, and if that trend continues, then that's bad news. But at the same time, in relative to a lot of other diseases, the numbers are actually still low, compared.
I see this with people. They're saying, "Oh, look! I mean, look, flu kills thousands of people a year. It's nothing like as bad as flu. Come on, everyone." The problem is that that's based on a little bit of a false understanding of virology, because it is true that flu does kill thousands of people across the world every year. The reason is that certain people are more vulnerable to flu than others. So flu can cause a kind of cascade of issues that can basically be the final factor that finishes people off. Yeah. But flu normally kills the very elderly or people who've got very compromised health because they have some other kind of serious condition. Then you get a bad flu on top and it overloads the body. Now, flu kills on a basis of about, depending on the strain, because there's multiple strains in the environment and which ones are dominant kind of changes from year to year. Yeah. But flu will kill between 0.1 and 0.2% of people who catch it. So a 0.2% mortality rate would be a very bad flu year. Of course, I hate to break anyone's bubble here, but we're all going to die one day. So, flu's mortality rate is kind of under control and is kind of a statistical background average, So, and of course, it's mitigated from health strategies and vaccines and everything else. Whatever we think about vaccines, it's part of flu mitigation. The problem is that if coronavirus, if this COVID-19 was as widely spread in the environment as flu, it would kill a lot more people because it's a lot nastier, it's a lot more aggressive, and the way that it attacks the lungs very quickly can completely overwhelm people and really just not give their body a chance to fight it off in the way that they would do with flu. So although flu kills far more, flu has at the moment has the opportunity to infect vastly more people. But if COVID-19 was as widespread in our environment as flu, COVID-19 would be taking significantly more people with it every year, on a continuous basis. Now, mortality rates and numbers, they have to be understood to be. It depends on how you look at them. Now, the World Health Organization revised the mortality rate for COVID-19 up from 1%, which is what the Chinese numbers were kind of indicating, to their own numbers when we started to look at what was happening with cases coming out in other countries. So currently they give a mortality rate of 3.4%. Now, that is terrible in itself because, that's saying that, of every 100 people who catch this thing, 3.4 will die. But that number in itself is misleading. If you look, it's a statistical average of all cases. It's not an individual prediction of personal chances. So, if you are young and in the prime of life, it's unlikely that COVID-19 is going to be any more dangerous to you than a regular flu. Yeah. Now, you can be young and in the prime of life, and you can die of regular flu. It is possible. You can get an unfortunate chain of circumstances, But basically, those who are pretty young have got the best chance against this thing. However, once you get past 50, and the numbers start to shift, because as we get into our fifth, sixth, seventh decades, our lungs become a lot less efficient. and therefore we were less good at getting oxygen into our blood supply. So that when our lungs get the COVID virus, especially when you hit your 80s, you're looking at a mortality rate that's currently trending at about 15%. Now we've already had 3 deaths in the UK.
I think it's 4
and
now.
our cases in the UK are going up very quickly now.
I think it is 4.
Yeah, is it 4 already? There you go.
I think I've heard it.
If you look at the people who we know have died, the British people we know have died so far, you will see they all match that pattern, but they are older people. But that doesn't mean that this isn't a threat to everybody, and it also, if you are young and you catch it, and okay, maybe to you may not, you as I'll discuss a bit later in a bit more detail, you may not even know that you have it.
It's actually 5 in the UK now. 5 in the UK.
It's up to 5,
yeah.
Right? If you have to understand that you are contagious and you are a threat to others who could die from this. So we are in a situation where, as a society, we've all got to kind of wake up to our responsibility to each other here, and the quicker we do that, the better it's going to be for all of us. So let's try to break this down a little bit more. I mentioned the World Health Organization declared an international emergency at the end of January. Now, at that same time, over in the United States, there was a debate about shutting down air travel from China, which was very controversial at the time, because President Trump must be racist, But Senator Tom Cotton spoke in the Senate, and he spoke about the threat of COVID-19. Now, what he said was very significant because, firstly, he spoke to the virus's lethality, and he described it as China's Chernobyl.
Right. Yeah.
Now, the information that we've got from China is limited. And we have to bear in mind that the Chinese state is a totalitarian dictatorship. Now, when this thing first emerged, there were a number of very alarming videos and snippets of video and snippets of reports that got out of China. And they were around on Twitter. I don't know if anyone listening to this go digging to find these things, but just the stuff that we were seeing there was extremely alarming. It seemed that China decided to take a very, very brutal response to this, and was using full military tactics to lock that city down. But even so, it didn't work because we know that the virus is in all areas of China. So when China says everything's fine now, I recommend that people treat that with a big, serious dose of salts. Because even when they say the number of new cases are dropping, well, I've just seen that claim for South Korea being made about the last couple of days, and I had a look at it, and the cases reported dropped on Sunday, but they rose on Saturday. And I know if you look at the 8-day pattern, it only actually dropped on 2 of those 8 days. So and this isn't people being cured. This is new cases being identified, and that's as well as we could trust the numbers in that. There's going to be a lot of people who aren't being identified. Well,
this is just it. The thing is that makes me question it a little bit is we're just talking about cases that have been reported, probably people that are already in hospital and catch it or something. But, I mean, there's got to be a lot of people out there that have got this and sleep it off for a few days. Oh, that was a horrible flu I had. And that's it. They don't even consider that it was the COVID-19.
No, that's good. That's definitely going to be a factor. Yes, that is definitely going to be a factor. But this thing is just so contagious. I mean, I'd like to keep a focus on what Senator Cotton said for a moment, because he described it as China's Chernobyl. He described how dire the situation is in China. Obviously, he was arguing for a shutdown of travel. But he also spoke about how this thing got started. Now, there is the initial media reports blamed the Wuhan fish market.
Oh, yeah.
and suggested that this thing had happened because somebody had been eating bats, and a bat virus had transferred into something communicable between humans. Now, you could categorically rule that out because it was categorically ruled out by the WHO because they tracked patient zero, and patient zero had nothing to do with that market. So the virus went from patient zero, communicated to others, and then went into the market before it came back out of it. And what kind of facility might we find in Wuhan, Paul?
Military?
Would that be a military experimental laboratory looking into all kinds of very, very, very nasty viruses? Bloody hell, look at that.
Yeah, and
In fact, Wuhan is so notorious for that, but the writer, Dinar Kuntz, wrote about it in a 1990s thriller.
Yeah, I heard about that, and it was quite interesting. I've done a bit of research, and one of the questions I saw on some group chat about him is from years ago. Someone asking if he was a Freemason because they thought that his work sounded like he had Freemasonry in his work, and that's interesting. Now people are questioning that his work in terms like that. So it does make you wonder, doesn't it?
Well, now look, I mean, we have to be very careful here because I want to make sure that we talk about what we know. But we do know that there is such a facility. We don't know that the virus came from there, but Senator Cotton certainly suggested that it did. However, the Chinese have responded to that by suggesting that this is a CIA plot to try to blame China, and in fact it's America who's responsible. So we're going to see an international blame game break out over who is responsible for all of this. And I don't want to feed into that tonight by automatically believing one side or the other in it. Yeah. But the bottom line is the way this thing operates. If you wanted to design something that could completely screw over a society without being too lethal, maybe as a sort of a precursor weapon, you know, that would soften a country up before a full-scale invasion, something like that. This thing's perfect. It's absolutely perfect. It's the worst disease you could imagine because of its sheer contagiousness. Yeah. And I think that we're now starting to see signs of this in the way that the West is struggling to respond and trying to respond. And of course, yesterday, people in northern Italy got a bit of a shock because 16 million Italians have woken up to find themselves quarantined.
Oh yeah, they're really. So yeah,
we are going to, whether we like it or not, the next few weeks, months ahead are going to see some very. We're going to see a degree of curtailment of the freedoms that we consider to be normal.
Yeah.
We must, partly why I take this subject so seriously is because I am very worried about our society. I'm worried about how well we will cope if we are pushed over the line. Our system straining. This thing gets too good a grip too quick, and we are certainly seeing strong signs of that in what information we have from Iran. Iran is currently declaring over 6,000 infected and over 300 deaths.
I have heard. I've heard somewhere that there seems to be a link to high polluted places like Milan, wherever it was in China. I can't remember what it was now, but it was known as a very polluted. So that could play a part as well. And perhaps the pollution is weakening people. And that's making it worse.
That's an interesting speculation. I haven't really looked at that myself, but yeah, I mean, if you live in an environment where you're under a little bit of background strain all the time, yes. Yeah. But anything that strains your body, anything that strains your immune system, anything that tips the odds a little bit the other way, yeah, it could make a difference. So I have to admit, that's an interesting hypothesis. So, right, let's try to talk a little bit about what this thing is, and why it is such a bastard. Now, I mean, we've dealt with the issue of this isn't your normal flu, right? We've dealt with it's more infectious, and it's faster, and it's more aggressive. So, what we can look at from there is that how it spreads, how it works. Now, a COVID-19 virus, the way that it gets into your system is it gets in through your throat.
Yeah.
There's also some suggestion that it's capable of getting in through the eyes. Now, in a similar way to SARS, the main transmission route is if you get bodily fluids expelled by somebody coughing, but get into the environment, and they get directly into somebody's nasal passages or mouth, onto their face. But also because it spreads this around the surfaces around where somebody's coughed. So if you're in a lift and you cough on the lift buttons, or on a handrail, or in the bus, or the train, or any kind of public space. Now, this virus seems especially good at surviving, and there seems to be evidence suggesting that it can survive in the environment much longer than similar kinds of flu viruses. So that instead of being a danger for a day, it's a danger for maybe 10 days to 2 weeks.
Yeah, that's the real big problem.
So,
isn't it? Yeah.
So immediately you've got to. But our environment is going to fill up with this virus. And the more people catch it, the more of this virus there's going to be in the environment. So there's more of it for people to catch.
Yeah.
As well as directly being within the radius of somebody coughing and picking it up that way. Once that person's out of that environment is effectively contaminated for several days.
It's almost like it might be worth, if you're younger, there's almost an element of maybe it's best just to get it now, sleep it off for a few days, and then that's it. You won't get it again. Do they know? Can you get it more than once? Or
well, we don't know that. We don't. This is a new virus. This is another thing. I mean, people talk about testing kits. It's not as simple as that because it's new. So, yes, you could take a testing kit for SARS or a different form of coronavirus, but it doesn't mean that testing kit is going to be properly effective at identifying this one. It could give false positives. It could give false negatives. So, it's simply not as easy as saying, oh, it's a testing kit. There's a lot, this is a whole new world with this virus. There's been similar viruses, but they're not the same virus. And the thing, and that's also, is why the international response is so important on this. Sorry, Paul.
But I mean, I was just going to say if there's someone that hasn't died but they know they've got it, then there must be an element to test that. So why would that test work but not a test kit?
Well, it's because it's what you're looking for in a test kit. So you can test for a virus when that somebody's infected in a different way than if you don't know if somebody's infected. You see. So once you think, oh, this is pretty much it. Could you basically do the kind of tests that work on that? But if you're looking for a quick test, that's different. Back to this thing of better to get it. Well, no, it isn't better to get it, but I understand exactly what you mean. But if you're low risk, but you think, yeah, I'll get it out of the way and I'm done. I mean, that's obvious enough. But the problem is that you've still got to self-isolate for quite a length of time. Even if you get better from this, we're looking at a period of 14 to 28 days. And we don't really know for certain, at what point somebody is still a risk to others. It's a very difficult situation that we've got here. So it's just not as simple as we want it to be. Whichever way you look at it, and of course the world's best experts are looking at this. It's a complicated, difficult, multifaceted problem.
Yeah,
And
it doesn't. There doesn't seem to be a lot of explanation.
Sorry, Paul.
So it just seems there doesn't seem to be much explanation going on. No, there's no guidance or anything apart from wash your hands. That's it.
I'm going to come to hand washing because it is. I mean, look, that worries me actually because it's already become a cliche.
Yeah.
But in actual fact, hand washing is one of the very best things that we can do. So why that is, is principally to protect ourselves.
Yeah.
Because what we don't want is the virus on our hands, which is how we mostly interact with the environment, using our hands. We touch things, grab things, But if we get the virus on our hands and then from our hand we put our hands to our faces, we're going to infect ourselves.
Yeah.
And there are so many points at which you need to consider, when you might have taken another action that might mean you've refreshed the risk of infecting yourself. I think that the elephant in the room is a question mark over whether this thing is capable of becoming aerosolized. Now, in terms of what Senator Cotton said in the US Senate on January 30th, he seemed pretty certain that it was. Other health authorities have not said that. But then if I was them, I might well understand why I wouldn't want to say that. Because the idea of a virus like this being airborne is really horrifying. But we might need to consider how fast this thing is seen to be spreading. But that's really as much as I want to say about that, because I don't want to make people afraid.
So let's
any more than necessary.
Just to explain what that is. When it's airborne, that means you no longer catch it from person to person, but it's just in the air, basically.
Well, look, if somebody coughs, right, there is a dispersal range, right, of somebody expelling micro droplets. I mean, often we can't really see this stuff, right? It's very small, but it's around 2.5 meters. So, if someone's coughing and you're more than 2.5 meters away, you're not going to pick up what they're coughing in terms of viruses. You should be outside of that.
Yeah.
But if something's aerosolized, then it can drift right the way through a room.
Then it's,
So the ability to infect others as people are breathing in and out the air in the environment with virus floating in the environment, doesn't bear thinking about, you see. So I can quite understand why they would not want to say that. And, if nothing else, because it might make people want to give up and think there's no point to fighting this thing. But it's vital that we do fight this thing, because we must try to slow it as much as we possibly can in order to give the maximum possible chance for the medical systems that we've got to help the people who are very seriously ill, while slowing down the increased rate of more people becoming seriously ill.
Yeah.
So the virus enters your body, and what it will do then is it will lodge itself in your throat, and it will then sort of basically stick itself to your throat, and then it will start to brew, a bit like a boil. Yeah. I mean, not a literal boil, but a boil of virus. And here's the next part of bad news here. That can take between 14 to 28 days, during which time you could be shedding virus yourself to other people, and you haven't got any symptoms. You don't know that that's the case at all. That's another part of this which is horrifying, is that you can be contagious, you can be heading to have a bad time with this thing, but you've got no idea for anything. I mean, it depends on the individual case, you see. I mean, but we're looking at, but not the information seems to be, but it's incubation is actually anything from 6 to 41 days, but the average is around 14. So it's gonna lodge in his body, and it's gonna be brewing away for 2 weeks. At that point, the viral host cell will burst with a whole bucket of the virus. So like one has become many millions, and it's going to flood your system very, very quickly. And at that point, whether you're very healthy or not, you're at least you're probably going to have a minimum a very bad flu, a very bad flu. Now, where it seems to get the most serious for people is when it gets into the lungs. Now, 80% of cases the WHO classifies as mild. Now, that's when, and this is important, this is not about a runny nose. This is about a sudden high fever and a dry cough. So you're looking at high fever and dry cough as the warning signs that you may have contracted COVID-19. Of course, that does match other things, but that's basically the symptoms that anybody with it are likely to experience. And that, in 80% of people, that would be the limit of what they experience, and that would be called a mild case. Now, a severe case is when people have trouble breathing. That's when the virus is getting into the lungs, and it's getting into the roots of the lung system. You see that the human lungs are much like a tree. You start from your main windpipe is the top of a trunk, and then it branches twice, and then it branches again, and then it branches again, and it branches again, and it branches again, right? And at the very end of all of those branches is a little inflating balloon, and we're talking microscopic, but these are called alveoli, and this is where the oxygen from the air that you're breathing transfers through a thin membrane and is picked up by the deoxygenated blood to get pumped back around your system and deliver the oxygen, which is essential for your whole body's operation. Now, what happens with the virus is that even more so, I mean, a pneumonia is usually only in one part of the lung, but in the worst cases of coronavirus, the entire lung gets incredibly infected incredibly quickly, which means that the lung gets inflamed, which starts to close the amount of oxygen that the alveoli can hold. So you've got a reduction of oxygen getting through into the bloodstream, and then worse than that then starts to fill up with fluid, but blocks oxygen getting through whatsoever. So it doesn't take a lot to see, but in a critical case, you're going to die very quickly from lack of oxygen, and it's going to shut down your organs, and so that everything starts to pack up, kidney, liver, everything, and then you probably have a heart attack. So this is a very serious. Now, critical is estimated for 6% of cases. Yeah. Now, these are the people who are going to have to be hospitalized. And it is in that category that people are going to have to be respirated, given artificial respiration to maximize the amount of air going into, the amount of oxygen but going into them, to maximize the chance but some of that oxygen, enough of that oxygen can get through to keep the body functioning. But this is really important. There is no cure for COVID-19. There's no injection. There's no pill. There's no vaccine. There's no cure for this at all. all that medicine can do for people with this infection is to support them as best as possible for their immune system to beat the virus for them. And the difference between the people who live and the people who die is going to be between the people who that support is enough and the people for whom that support is not enough. Yeah. Which brings us back to why it's so much more dangerous to people the older they are and the worse their overall health is, especially if they've got bad news here, smokers, and also, you know, anybody with kind of asthma, COPD, you know, these kind of things, which are already impacting on their lung efficiency. The lower your lung efficiency when you get the virus, the worse your odds are if you become a critical case.
Yeah.
So, you know, this is all pretty damn serious stuff. And whatever we think about the world and the plots and plans of powerful people and all the shit that's gone down and that we've tried to understand and put a spotlight on over the years, when I look at these experts, I look at them in the eyes, these are not people pulling a scam. These are not people trying to pull a fast one. These are not people trying to create some excuse for some takeover or change in society. These are people who have spent their lives trying to help human beings who have been very sick. And these are people who are very worried because we're seeing the potential of this virus. Well, it scares them. I don't mean in a way that they lose their sense of reason, but it scares them, but it gives them a sense of how vital it is that they do their jobs well and that they communicate to people, because our best chances as a society are going to revolve around some pretty important behavior changes in order to protect ourselves and also protect our family members. Because I mean, the British government, from its COVID meeting last week, it was already announced that it's preparing for several things. Let's try and look over them a bit. Now, the first thing the government has said is that a large amount of people are going to be off work. They've estimated 20% of people are going to be off work. And that's probably a low estimate. So straight away, let's try to imagine if 20% of the people doing the jobs that we rely on to keep society ticking over aren't at work, straight away there's going to be knock-ons for society from that. Police, fire service, armed forces personnel to be redirected to assist with efforts to basically support society to keep functioning and to help to fight the virus. Shops are likely to change what they stock. So instead of 100 different brands of cornflakes, you'll have one brand, cornflakes, packet. Yeah. So a large increase in increasing basic staples, and the reason is that there's a whole lot of time spent processing basic food to make the kind of food that we're used to. That we're used to seeing on in the supermarket shelves. And by cutting that out, then the supply chains become shorter. And basic foodstuffs can get out at people a lot faster. So, we're likely to see our food supply become a lot more sort of basic stuff. But that is good because it means that we can actually maintain food supply, so there's enough food for everybody.
Yeah.
And the government's very clear for people not to panic buy.
Well, they're not listening, are they?
Well, I haven't seen over panic. I mean, perhaps people. I've seen some signs that London has been clearing its shelves of toilet roll.
I saw it today. For some reason, people are buying toilet paper, this deluded kind of thing that's going to save them or something. Yeah, we've got enough dog roll.
I can't understand the toilet paper thing myself.
There was literally not one roll in the super. I just look. This guy walked past me and he said, "Man, someone's got a bad case of diarrhea around here, haven't they?"
Yeah. And also hand sanitizers are going out of fashion.
Yeah.
I tell you what, people really need more than hand sanitizers, and that's soap.
Yeah.
Because soap is wonderful stuff. Now, we also like to see the cancellation of large public events. So, football matches, concerts, anything that people gather in large numbers for. It's likely to be
football
closed
games
down.
and closed doors.
Maybe the shutting down of shopping centres. That's already happening that's all been happening over in Asia.
Yeah, and Italy, I think, as well.
And I think Italy as well. We've been shutting down shop.
So, I mean, with regards to generally these kind
people
of
commingle,
with regards to general things like just viruses generally, what generally? I mean, I'm not sure. Do you know generally what does that? They just sort of fade out, or people just slowly build up an immune to it? How would this pass by naturally?
Well, it's a mix of both factors. Yes, a virus needs a host, so it can only survive so long without a host. So, that's why we have a virus season, whereas we tend to be, when we get into the summer, it's the higher temperatures when the virus is outside of a body is actually more harmful to a virus. So the amount of virus in society tends to go down. We get into the winter months, it tends to go up. And of course, when people have antibodies, it's not that the virus isn't getting into their bodies; it's just not getting anywhere. So it's not that people have an immunity, so the flu doesn't go near them. If the flu tries its best, but can't get anywhere.
Yeah.
So ultimately, that will be how this strain, COVID-19, and of course, once we get a vaccine, will ultimately be defeated. But because of how contagious this little bastard is and how tough it is, that's why we're in an extra difficult situation here. Now, there's a little bit more to what Cobra said last week, which is that low urgency cases will be sent home from hospitals.
Right.
Because hospitals are going to have to be given over to fighting this thing. So if you've been sitting around waiting for a minor op or something, you're likely to find that your operation is pushed back, or if you're in hospital, it's basically for monitoring just in case. They'll send you home instead. So a bit less precautionary principle for other conditions. So what the NHS is going to be focusing on is going to be focused on the needs of coping with the virus. Obviously, border control officials have been given the powers to detain anyone entering the country that they think may be infected for quarantine and testing. New powers put in place so that people who are believed that might have the virus have to comply with quarantine, or they get significant penalties. So there's the sort of measures that we've seen so far. But we could indeed see more than that. I believe we may not be far off seeing the advice going out for the elderly to stay in their homes and to the elderly not to go out and about in society. For people to be very aware of try not to visit the elderly relatives, not like they have to come over with the whole family. Try to protect the elderly people about anybody who's high risk. So we're going to start to see things like that. And we are probably going to go as far, I think it was reported in the press just over 24 hours ago, we probably are going to see some UK cities quarantined.
That would be weird. So much for people that don't like borders, eh? Yeah. It just goes to show borders can be brilliant.
Yeah, well... I mean, it's a right kick in the nuts to globalism, this thing. I can tell you that.
Well, yeah, it's kind of an example. When if we only have one place then we can only make one mistake, and it's always vital. If you've got lots of places, you can have mistakes go on and people learning from them, and all that. At the moment, the world's becoming one place, and that puts us all it makes us all vulnerable, you know.
Well, you know, I mean, back to we don't really know what caused this thing, because it is, you know, it is so good at what it does. You know, it's not that it's the most deadly lethal disease we could imagine, but it's so good at disrupting society.
Yeah.
You know, and of course, it doesn't take much to see that could lead to other deaths in other ways. In fact, in Italy, they just had prison riots because they told the prisoners they couldn't have any more visits. Yeah. And so they had major riots all across their prisons, and 6 people died in prison riots yesterday. Because of how prisoners not reacting very well. Well, meanwhile, Iran is kicking its prisoners out. Emptying its prisons.
Why is it doing that?
Well, I can only speculate, but I would think because they can't maintain them.
Yeah.
You know, so if you when you hear something like that and you think, good grief, they really are getting towards the kind of everybody, you know, best of luck, everyone. It's very bad in Iran. We really don't know how bad it is, but it's very bad in Iran. And
of course, tomorrow we can wake up and someone comes up. We've got a vaccine for this, and then they start this. You know, I mean, I heard that it was quite similar to SARS virus. Therefore, to find a vaccine, you've just got to sort of start with that basis, and it shouldn't be too difficult to find one.
Well, we're in the realm of hoping on that one.
Yeah.
You know, yeah, could be, but even quick to develop a vaccine. Well, you know, the word "quick" doesn't really apply to developing vaccines. Obviously, the first drug company that comes up with a vaccine for this, you're going to be, you know, set for life. You know, but so in that sense, the race is on. But I don't think we can realistically count on a vaccine before the summer.
Yeah.
You know, and that's sort of breaking the news on that one. You know, and even if someone did come up tomorrow and say, we've cracked it, we've got the vaccine, you've then got the problems of brewing up that vaccine in order, you know, to vaccinate the world population. That's a huge task in itself.
Well, you probably wouldn't even need to vaccinate everyone. It would just be a lot of people, and it would kind of reverse the trend.
Start with the higher risk. Obviously, you start with the higher risk categories, you know.
And people that are travelling.
A vaccine will come.
Yeah.
You know, that mankind will find the vaccine to this virus, because mankind's found the vaccines to every other virus. In a funny way, if it has come from some kind of laboratory, that might help. Because that might actually make it easier to develop a vaccine, because of having the research of how this thing might have been engineered to do what, you know. But it's all very speculative.
Yeah, that's just it. It's just very.
And of course, the other
no
thing
one knows what's going on.
It is. We have to admit it's speculative at the moment. What we can't speculate about is the fact that there are more and more people becoming sick from this thing, and because of the way it can stay in the environment 10 times as long as a flu, and because of the way it brews inside people, you know, what we see when we see a new case emerge today, when we see, you know, someone's got a high temperature and a dry cough today, and you think about all the interactions that person has had since they caught the thing, and how those people may have been infected, you see that what you see in terms of new cases is just the tip of a wave. And in many ways, this thing is like a wave breaking across the world. So, you know, how best do we cope with this, you know, this virus wave? And that's the challenge for our society. That's the challenge for us collectively and individually. So, you know, this isn't going to be something that we can ignore.
No, yeah,
as much as we might love to.
I think it's impossible to, because the media have this absolutely everywhere you look. It's in the media.
Yeah, but I don't mean just in terms So this isn't something you're going to be able to ignore because Sky News is banging on about it. I mean, it isn't going to be something that you're going to be able to ignore because it is going to directly affect your life.
Yeah.
Whether it's because you become sick or whether it's because people that you know about become sick, or because if the measures against the virus are going to affect your normal routines, shut down your workplace, shut down your kids' schools, and so forth and so on. There's going to be no way to avoid this in terms of affecting our normal for the good few months to come. And it doesn't matter where you are in the world listening to this right now either. It's going to be, if it's, Britain, realistically, we seem to be between 2 to 3 weeks behind Italy.
Yeah. I mean, Italy at the moment, what it is, 9,172 with 463 deaths. And
hot shit.
Yeah, that's pretty, that's quite
so.
Mind you, as I said earlier, that's 9,172 reported cases. There could be 10 times the amount of that.
If each one of those people might potentially have spread this to maybe 10 people.
Yeah.
And each one of them would potentially to 10 people and so forth. When they say, that they're expecting 70% of the world's population to catch this thing.
I mean, it's quite strange because Italy's actually in theory worse than China, because China's got just under 90,000 or 81,000, sorry, and 3,120 deaths. So that's actually a better ratio than what Italy's ratio is terrible.
Yes, but I just suggest that people don't take any of the numbers from China, especially as necessarily definitive. Let's put it that way. Yeah. Because this is going to become an issue where the major powers of the world are going to vie for advantage over each other over this, whether we like it or not. And with the damage being done right now to the US stock market, also our stock market, and with world oil prices dropping 30% today, you can see that, let's just say that China has an incentive to appear to be doing well with this.
Yeah. In what way do you mean
then
that?
Considering, we're getting better, so invest in China.
Oh, right, okay, yeah.
Because China's shut down its whole economy. But when we've got some of that secret footage that came out of China showing people being welded into their apartment buildings, one might wonder how good their number counting really is, you see. And I'm just suggesting that don't take a false sense of hope out of statistics that may not be reliable.
Yeah.
It's a difficult situation. What can we say? It's a difficult
the USA, the USA have actually been pretty good, 607 with only 22 deaths. For such a big country, that's actually not too bad.
Well, again, the experts in the USA are saying they've already failed in the containment phase and they're into mitigation. So these numbers, the media numbers, I'm tending to listen more to what the experts are saying from the World Health Organization and and from the various task forces, because they've got different motivation than the media, so to speak. And I kind of think that we need to make sure that we hear them, whether we accept it without question or whatever. But we need to make sure we hear what they are saying. So people like Dr. Bruce Alward from the Assistant Director General of the World Health Organization, and what he's had to say leading the team, and other experts who've described this as a war.
Yeah.
And I agree with them. It is a war. We are at war with this virus every bit as much as we were at war with Nazism in World War II. And it's going to take a nationwide, society-wide effort to beat this thing as best as possible. And the worse we do at that, the harder recovering from this will be as a nation.
Yeah. I guess really the next sort of 3 weeks to a month or so are going to really tell us what's lays ahead.
They really are.
If things were to improve in that time, then we start to think, okay, maybe we're going to see the end of this. If it carries on in that time, then we're really going to start thinking, right, we've got something ahead of us here. That it's going to be a big few weeks.
I agree. Yeah. And I'm quite happy to just put my hands up and say, hey, John, you told us we had to take coronavirus seriously, you idiot. I'd be more than happy. Yeah, believe me. I would not care less.
Yeah, it's one of those things you'd like to be wrong with.
The problem is, I don't believe that, boys and girls.
Yeah. Well, I think it's all good. We're cautious
because I want to go. Cover some
we're on the hour. So if you've got anything,
let's do the advice. Let's do the advice now. Yeah. I think we've had a good talk around. Yeah. So you're looking for symptoms of high temperature and a cough. Now, in terms of first things first is be aware that people coughing spreads the virus. So if you come across somebody coughing, you just step back from them. Yeah, don't get into that 2 meter zone while somebody's actively coughing. Now, if you can, and you have one, give them a mask to wear. Because for people this is very important, people wearing masks are mostly wasting their time for two reasons. Number one, if the mask is not a sufficient enough grade, then it won't stop the virus passing straight through it. So it's got to be what we call an N95, which is the size of the holes in the mask have to be small enough that they block the virus from passing through it. Obvious, yes? Although that's not to say that it doesn't cut down on droplets coming out. So it's still better for anybody who has the virus must wear a mask. Whether they really shouldn't be out in society if you have the virus, but if you're being nursed, so you see you've got a family member sick at home, they're going to have to wear a mask, and you're going to have to wear a mask to look after them. Yeah, to cut that down, to cut that risk down. Now. Yeah, but also don't go thinking that just if you see someone with a mask on, they must be sick, because they could be looking to protect themselves. But generally speaking, just walking around with a mask is not that great an idea, unless you know that you need to wear one in that situation. It's much better to wear gloves. It's much better to have gloves, and you want gloves that can be washed at 60 degrees Celsius. You want every piece of clothing that you wear to be clothing that can be washed at least 60 degrees C for 10 minutes. So if you've got your soft woolens and so forth, put them in a drawer and don't wear them, and make sure that your washing machine is cranked up to at least 60 for 10 minutes, ideally higher, because that's what you need to kill any virus that might be on your clothing. And you have to be aware that when people cough, they cough into their hands, and then all the things they might touch, like doorknobs, pens, computer mice, keyboards, mobile phones, cutlery, cups, digital devices, light switches. These are all dangerous. These are all possible dangerous objects. If you know that you've been around, someone with a virus has been around, you need to get all of those things cleaned. And the most important thing, if you wear a mask, and you're wearing gloves, and you go and touch your face, you've wasted your time. Absolutely wasted your time. So the discipline to leave your face alone is an absolute survival habit now that everybody should try to pick up. And of course, as I mentioned at the start of the program, I learned that from years of health and social care. Because I learned that if you can't keep your hands away from your face, you're going to make yourself sick. You're going to be off work, and you're going to lose money. Yeah. So I had a good incentive, and then wash stuff down, surfaces, kitchen tables, desks, everything else. Wash it.
And I suppose this all leads back to the essential washing your hands, because all this stuff, like whether it's on your clothes, whether it's on your desk, essentially the most primary way of getting it is you put your hand on the desk, you pick up the disease,
wash your hands,
and then you scratch your eye.
Wash your hands when you normally would, so after using the toilet, before preparing food, but also at the end of every journey. It's the immediate thing is to be to wash your hands, and if you have anything to do with anybody with a virus, as soon as you finish, you need to wash your hands. So really, I hate to say it, you just cannot wash your hands enough. And when we say wash your hands, right, I don't just mean it isn't just a quick splooshy sploosh, right? We need to do a thorough palm to palm to back of hand, in between finger webs, in between fingertips, and also all around the thumb rotations. So we're talking about a minimum of 20 seconds of vigorously scrubbing with warm water and soap. Enough time to sing Happy Birthday twice.
Yeah.
So you try to. Most people wash your hands if you just go beep 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 beep, done. That's not washing your hands.
Yeah.
That will not remove virus from your hands. You've got to be 20 to 30 seconds of continuous washing. Yeah, and then of course we've also got to deal with the towels. Because if you're not careful, you wash your hands. Oh, look, you've just reinfected your hands from the towels. So you've got to have clean towels, and you've got to have separate towels for every member of the family. Vital. And you also got to go for separate cutlery and separate plates, and you must not have a situation where people are sharing from the same bowl. If you've got a meal of some kind where everyone's dipping in with their personal spoon, no. So we've got to be more disciplined about how food is served. So these are all this is the basics of home infection control. Now, when it comes to masks, a mask at most is good for a day. That's why you're largely wasting a good. Even if it is a good mask, if you don't really know that you need to wear it, you're mostly wasting that mask when it could be better applied. So you never wear a mask more than one day. So again, masks are not really the answer, but they do give people a certain sense of comfort. And of course, if you're going out for one big day, then maybe that's a different story. But be aware that masks are limited. So separate bowls, separate towels. Always wash your hands with soap before you eat and after being out in the public, as well as after going to the toilet. Now, if you follow that advice, you're going to cut your risks down a lot, and that might make the difference. And we need to be aware that we could very well have to look after a family member who is sick. Or if you live in shared accommodation, the people in your building are going to get sick. So you need to think about protecting yourself on multiple levels. Now, I have put together an article. I'll make sure you get the link, Paul, and we'll make sure we do get it in the description on this, where I've collected together this kind of advice with infographics. So that may help people to understand this, but it's these personal infection control. Every successful act of personal infection control is a personal win against this virus. It's denying it one more opportunity. So I agree that, especially if this is panning out how it looks like it's going to be panning out, we could get in a situation where we might start to feel overwhelmed and start to feel despair about this thing. But we've got to toughen it up, and we've got to fight back against that. We've got to steel ourselves about this, and we've got to become disciplined and serious and determined. Because every single action we take that slows down this virus is going to potentially help save a life.
Yeah. No, I mean, no matter, even if people were skeptical about it all and stuff, it's a disease. It's out there. You just got to be sensible, because it's something you don't want to risk. if it turns out that it's not as bad as a lot of the media was saying, then great. As you said earlier, then we're delighted to be wrong.
Hallelujah.
But it doesn't. Hygiene isn't something that we should be worried about doing anyway. It's good to be hygienic, and we just got to be extra hygienic.
I don't really think that the nations of the world would be starting to mobilise sort of big, serious national action plans and making big, serious actions to restrict what we have, especially in the Western world, have become used to as basic freedoms on the basis of nothing. Why would all of the nations of the world agree to sabotage all of their economies? Which is what when you've got to shut down factories, how do you cross that count in economic growth? Forget the stock market. It doesn't matter right now.
Yeah. I mean, and I think it's disgusting, some of these companies that are charging like £20 for hand sanitizer and stuff like that. They're just crooks, you know what I mean? It's like it's
profiteering.
Yeah, I think what could be quite good as well is to make a note of shops or people that are starting putting up these prices and stuff and shame them. And when all this is all over, just have it. So remember what these guys done.
An alcohol-based hand sanitizer, yes, it's good to use, but it's not as good as soap. So whatever you do, don't think that a hand sanitizer rub is a replacement for proper infection control hand washing. It is not. Right. And anybody who works in health and social care will tell you that.
Well, there you go.
Should do anyway, or they're training shit. So.
Yeah. Well, anyway, I mean, we've got, because it's been quite important. We've gone over the time a little bit. We have got to start wrapping up. Is there anything else important you'd like to say before we do?
I think we've managed to get there, Paul. I do. I can only say good luck, everybody.
Yeah.
I've tried to be responsible in this broadcast, because I do believe that people need to hear it from as many ways as possible, and maybe hearing it from us might make a difference in sort of making people go, hang on, these guys are saying something, in which they would be ignoring it because it's just bloody Sky News.
Yeah.
You know? So if we can make a difference, it's worth a try, isn't it? I hope we've managed to do something with this broadcast.
Yeah, it's a case of not getting in a panic, not worrying, but being responsible and just listening to this advice and keeping it in mind. Because even if people just do it all a little bit, it's still making an effect. It's still going to collectively.
Yeah. However bad this gets, it is our determination and our reason which will get us through this. Yeah. And if we start to panic, and if we start to get into a fluster, and if we start to think only of ourselves, we'll probably ultimately do ourselves more harm than good.
Yeah. And don't worry about the toilet paper.
Keep it calm, carry on, and let's beat COVID-19 together as a nation.
I think that's a good area to end it on. Thanks again, John. I'm sure we'll be speaking to you soon. Thanks all for listening. Take care. Bye.